Hello friends, welcome to Furhour Talks. Today we are here at German Vet Clinic meeting Dr. Katrin, who is one of the best vets in UAE and a psychiatrist and a behaviorist too. So let's dive into the conversation. Hello Dr. Katrin.
Hello, lovely to meet you.
Lovely to meet you too. How are you doing today?
Very good. Excited to chat to you.
Welcome to Furhour Talks.
Thank you.
So let's quickly dive into the conversation. So can you share your journey? How did you get into veterinary? How did you get into behaviorist and psychiatry?
Yeah, so how did I get into veterinary is a good question. So I think I was one of those teenagers who knew from quite a young age that they wanted to be a vet. So I was a horse rider when I was a young girl, grew up with animals. So I knew quite early that I wanted to be a vet. So I chose my university, or I chose my high school path to allow me to go to vet school, which I did in Germany, in Munich.
Okay.
And then after I graduated, I worked in the UK for about 7 years before moving to the UAE in 2006. And then I started this clinic in 2008.
Okay.
And in terms of behavior medicine and veterinary psychiatry, so when I opened this clinic, I realized very quickly that we're really good at taking care of the physical health of our pets, but we're not so great at taking care of their mental and emotional health.
Right.
And so I got really interested in that, and we became a cat-friendly clinic, then we became a fear-free clinic, and then in 2019 I did my specialization in veterinary psychiatry.
Okay. So what exactly is veterinary psychiatry?
Yeah, it's a great question. So basically I treat pets that have anxiety problems, fears, phobias. They might show that through aggressive behaviors, maybe house soiling issues, stress, abnormal repetitive behaviors that we sometimes term compulsive disorders. So some of the things can be quite similar to human psychiatric presentations as well, but it's so fascinating because every pet and pet parent complex is unique, and oftentimes all of those sort of different dimensions together can contribute to the pet's behavioral presentations or signs.
Okay. So the psychiatry issues which they face, are they similar to the human psychiatry, like how we face for the OCDs and other behavioral issues, and also they also have the similar ones?
Yeah, exactly. So especially those, like you just mentioned, OCD. So we don't talk about obsessive in pets because we're not sure whether they are obsessing, but certainly abnormal repetitive behaviors, which in humans can be these compulsive behaviors, we see that. And for sure, anxiety disorders, we don't see depression as such in pets, but anxiety disorders and results of trauma, we definitely see that. So yeah, there's quite a big crossover and quite a big correlation.
Okay, okay. So you said that results of trauma. So if let's say that there are traumatic pets are coming to you, or traumatic animals, even the stray animals, they go through a lot of trauma and everything. So in that case, how do you help them in emotional way or?
Yeah, so we have quite a multimodal treatment approach, which means there are lots of different elements that go into a treatment plan. The first thing I think that's important to say is that even if an animal has experienced a trauma, it doesn't necessarily mean they're going to suffer from it, just like with people, right? Some people experience trauma and they bounce back, they're resilient,
Right.
and others don't. And it's the same in our pets. But when it then does come to those pets who are suffering from previous traumatic experiences, we apply like a 7-part structure, like a framework,
Okay.
which looks at their physical health and physiological health, so their nervous system. It looks at how we can manage the environment better. It looks at learning, so how can we use behavior modification and training to help them. We educate the caregivers, so that setting expectations is an important piece. And then, of course, we use psychotropic medication. So that's probably a very unique piece in veterinary psychiatry, is that we are able to use medications that alter the way the brain works essentially, and that can reduce anxiety levels, reduce aggression, reduce impulsivity. So that's quite unique, I think, for us vets that are dealing with behavior problems in pets.
So while you are treating the pets, do you have to even give the counseling sessions to the owners, the pet parents?
That's a good question. So yeah, absolutely, because obviously the owners are the ones that will be implementing the treatment and that will be making environmental changes, and having those sometimes quite difficult conversations is a really important part of what I do. And it's actually interesting, over the years of doing this, I have built such strong relationships with the pet owners because I essentially become part of their families and part of their treatment plans. So yeah, that trust piece and that kind of bond piece between myself and the pet parents is really important.
Okay. So I believe even you have pets.
Yes.
You have, when I was speaking to you privately, you had said that you have 2 cats and 1 dog.
Correct, yeah.
So could you introduce like them? Like you can tell us about their personalities and who they are and all?
Absolutely. So the dog that we currently have, so we had 2 dogs. We lost our other dog, Polly, a couple of years ago. So the one dog that we have at the moment is called Lexi. And she's also an older lady now. She's probably somewhere between 12 and 14. So she was a rescue, so we're not sure exactly how old she was.
Okay.
We rescued her after we got married because we wanted to give a home to an older dog that probably was going to struggle to find a home easily. So she was already 6 or 7 when she came to us, and she is just an absolute joy. She does have some quirks, like I think they all do, from previous experience. She was in a shelter for a long time, and then she had a number of different homes. So I think all of those things play into their behavior. But yeah, she's just lovely. She's definitely an older lady now, but yeah, she's gorgeous. And then our 2 cats. So we have one cat called Lizzie. All of my animals are all rescues. So Lizzie, we've had her for about 4 years. She's actually an FIP survivor. So she got really sick with FIP when she was a kitten. And luckily we got hold of the right medication for her. So she survived that because that's...
What is FIP?
So FIP is feline infectious peritonitis, which is a viral disease in cats that is usually lethal. Usually they don't survive it, but there is a new treatment on the market. There has been for a little while now, and we were lucky enough to get that for her.
Oh, okay.
So she is our little angel. And then we've just had a brand new kitten actually called Daisy.
Aww.
And we're just learning how fun it can be living with a kitten again. She's so busy. And then obviously the big thing at the moment is introducing her to Lexi and to Lizzie as well.
So having cats and a dog, how is it living together with them? Like generally we hear the sayings that cats and dogs, they don't go along and everything. So how does it happen in your house?
So actually the cat and the dog is the easiest part. It's usually the cats and the cats that can sometimes struggle to live together. And we're seeing that as well with Daisy. So she's definitely already fully introduced to Lexi, so they're best friends now. Whereas the relationship between Daisy and Lizzie, so the 2 cats, is a little bit currently still, there's a bit of a standoff and they're just kind of figuring each other out.
Okay. So coming back to your profession, what kind of common behavioral disorders generally you see when you have treated you treat cats and dogs both, right?
I treat cats, dogs. I also treat horses,
okay.
rabbits, birds. So we do all species.
Oh, okay.
Cats and dogs make up the majority of my caseload, yeah. Okay. But I have seen quite a few other species as well, which is always interesting. I would say for dogs, probably the most common thing I see are fear-related behaviors. So I'm sure you've heard of separation anxiety and noise phobias, so fireworks, storms, other noises. Those are among the most common things. And then also generalized anxiety disorders. So that means dogs that are anxious or fearful in more than 3 specific situations. So we see that quite a lot, just a general heightened anxiety level, and that can then be even more heightened in specific scenarios, such as people coming to the home, out on walks, maybe dog-dog interactions, visits to the veterinary clinic. So those things are common. And then for cats, the most common thing I see here in the UAE are inter-cat aggression cases. So that would be either 2 or more cats living together in the same household that are fighting with each other. That's the most common, and then the second most common would be cats peeing outside the litter box.
Okay, and with horses or any other species which you have come across?
Yeah, horses is an interesting one. So horses can be a variety of things, maybe fear-related behaviors, riding-related or handling-related behaviors. But in horses, much like our dogs and cats as well, pain or other physical disease can play a massive role in behavior. The birds, we see a lot of feather damaging behavior, so the birds that pluck their own feathers out, which can be that compulsive behavior, can also have other medical causes. So yeah, there's so many things, but those would be the most common things I see.
Okay, and how does a behaviorist differ from a trainer or a general vet? How does it differ?
So we're quite similar to vets in general, in that the way we approach our cases is quite similar to how any vet would approach a case. So we do the same thing. We take a history, we examine the animal or we observe them, we do diagnostic tests and we treat. I guess the thing that makes us different from trainers is that we look at the animal from all angles. So we look at their physical health to see whether that might be contributing to behavior. So pain is a really big piece there, or neurological disease, for example, skin disease, GI disease, the gut microbiome can influence behavior. So we look at that physical health piece. And then, of course, the other really big thing that makes us different is that we can dispense psychopharmaceutical medications.
Okay. So mainly you treat your patients with medication, or do you treat them first with the emotional factor and all other non-medical treatments?
So it has to always be everything. So if you use medication on its own, it's very unlikely that it's going to be successful.
Right.
So it's not that people come and we give them a magic pill and then everything's better. It's always that comprehensive approach of teaching the caregivers to read their pet's body language and emotions, understanding which situations are stressful for them and changing those. Always that management piece. And then always we bring in learning as well. We also look at things like sleep. Do they get enough sleep? Because that's really important. We look at things like teaching them how to settle or be calm so that they can access calm behaviors and self-regulate their emotion. We sometimes, when it's appropriate, we teach them how to deal with frustration. So increasing tolerance for frustration, increasing resilience as a whole. And then it always also ties in with the medical side of things. So making sure diet is optimized, exercise is optimized, the nervous system is calm and can regulate itself. And then come the medications, right? So it's always everything.
So in your clinic, you have a dietitian, you have the other factors which you just mentioned, the specialists for those also.
It's all me.
All you. Wow.
So I can do all of those recommendations. Yeah. I can recommend diets. I can recommend on sleep and on exercise. The only time that I might bring in a collaborator would be for those learning pieces. So I work a lot with trainers, for example. So I would maybe set the treatment plan and then the trainer might take over some of those learning pieces. So how to settle on cue, how to be calm. It might be some desensitization or counter conditioning to specific triggers, but we work in collaboration with each other.
Okay. So I'll come to this section. We are just talking about triggers and everything.
Yeah.
So few of my listeners, I'll share 4 cases of theirs with you.
Okay.
And you can throw a light on them.
Okay.
Because obviously we all have doubts and everything when it comes to pets. So the first one, okay. One of our listener told us she was sitting on the couch with her 3-year-old Labrador. Okay, the Labrador's name was Max, he seemed very relaxed, but without any warning, he turned and bit her arm, leaving a bruise. So she wasn't near his food, toys, or any other sensitive areas also. So why would a dog suddenly do this? What subtle signs might she have missed? And how could she prevent it in the future?
Yeah. So it's a common scenario, I think. And, you know, sometimes if I were doing a consultation, for example, with this particular case, I would be diving deeper and asking some more questions. But some of the things that come to my mind is exactly like you said. A lot of times clients say to me without warning, but actually there are a whole host of very subtle body language and communication signs that we as humans often miss unless we're quite tuned into them. So that could be very subtle signs of maybe asking for more space, right? So we call them distance increasing signals. So that could be turning the head away or trying to increase distance by showing, we call them displacement behaviors or sometimes fiddle behaviors. So licking the nose or yawning, for example, maybe showing the whites of the eyes, maybe pulling the ears back. So some of those signs can be subtle, and unless you're looking for them, you might miss them. So that dog might have been communicating subtly, hey, you're a bit too close to me here. I'm on one of my really important, valuable resources, my resting place. The sofa is where I feel happy and comfortable. And either maybe Max felt uncomfortable, she was getting too close to him. And in these cases, I always look for signs of pain or discomfort, because maybe was the owner getting too close, maybe touching him in a way that he didn't like, or maybe he learned that when she's this close, she might touch me, so I'm going to give some early warning signals to say, please stay away. And then if those kind of communication signals aren't heard or are ignored, maybe not deliberately, but you know, maybe she just didn't pick up on them, then he might escalate behavior to then becoming aggressive. Oftentimes that could start with a growl, maybe showing teeth, maybe air snapping, and then a bite. But maybe for whatever reason, if he was painful, he felt the need to escalate more quickly, or maybe he also learned that his communication isn't being heard, so he needs to escalate more quickly.
So is it like he was also looking for his own me time at that time?
So yeah, I think, you know, there are some resources that are very important to dogs, and you mentioned a few, right? Food, treats, toys, but resting places are also very, very important to dogs. Dogs sleep much, much longer than we humans do. They sleep for around 12 to 16 hours per day. And so finding a place where he can comfortably rest and sleep is really valuable to him. So yeah, you could call it me time, but you could also say that he was looking for a space in that moment where he wasn't being encroached upon, right? Where there was nobody coming into his space and nobody kind of disturbing him. So that's also a prime time sometimes for children to be bitten, right? Because the dog's on the sofa and they want to go over and cuddle them, and all of a sudden something bad happens.
Okay. Other listeners of mine, she said that 2 years old cat she's having, her name is Misty. Okay. And she was on her lap enjoying the head scratches and cuddles and all. Out of nowhere, she swiped her face with her paw, leaving a scratch under the eye. She just swiped it. So there was no hissing, there was no growling beforehand. Nothing was there. And what causes this kind of a behavior, this lashing suddenly, and like what body language she might have missed?
Yeah. So this again is something we see quite commonly, and the official diagnosis for this would be petting related aggression.
Okay.
And so many cats have a particular way that they like being interacted with, that they like being touched, or that they like being physically interacted with. And so many cats, even when they're sitting on your lap, they're signaling that they enjoy being close to you, but they don't necessarily want maybe prolonged physical interaction. So cats in general prefer short and maybe a little bit more frequent interactions than prolonged petting, even if it's just around the face, which is kind of a good area for cats. But then if you're scratching around the face, maybe you're not paying attention, maybe your hand slips a little bit, and all of a sudden the cat is like, now I feel frustrated. It's too long. The interaction isn't how I like it anymore. And then, yes, they might swipe or something like that. The prime body language signal to look out for here in cats is a flicking tail. If you see the tail starting to flick, or maybe the ears rotate sidewards, if you can see the cat's face, the pupils might dilate a little bit, right? They go from that lovely almond shape to round pupil. That can sometimes be a sign that emotions are rising. But the tail flicking, sometimes you might get like hair standing on end, that bottle brush tail. But tail flicking is probably the biggest sign. Sometimes it can be a small flick. If it starts getting a bit bigger, then I would say hands off. And if you see the cat's tail starting to flick, then I'd probably maybe, I don't know, throw a treat or encourage the cat to get off the lap so that there is no aggressive interaction. But in the future, be more aware of the body language signs. And if the cat just wants to sit on your lap without you touching them, then that's also fine. We don't always have to be touching them.
The third listener of mine, she has a beagle.
Okay.
Okay. His name is Toby, and he had been left alone for just 45 minutes. He had been left alone. So when she returned, the sofa cushions were torn apart.
Oh.
The TV remote was chewed, and the shoes were scattered. Actually, this thing I had noticed with my sister's dog also.
Okay.
The same thing. My sister has a rescue dog, and the same exactly similar thing we had noticed that also with him also. So this happened even with Toby also. Even though he had eaten his food, he was like completely hydrated, and his toys were also nearby. Why did he do like that?
Okay, this is a bit of a complex one, and it takes a bit of diving into. One of the things you said caused a little red flag for me, and that was when he's left alone, right? So it could be a separation-related behavior. Now, traditionally, we call this separation anxiety. That's probably not accurate anymore. Separation-related behaviors is a better term for it because it can be a behavior that occurs when the dog is separated from their caregiver, but can be driven by lots of different causes. So anxiety or panic at being separated from your bonded person, that can be one thing, but it could also be boredom, normal exploratory behavior. This is a beagle. Beagles are known for being very busy with the environment, interacting with their environment, exploring things. It could also be that maybe the caregiver's away and now all of a sudden I can do all the things that I've been dying to do, but I haven't been allowed to when my owner is present, right? So taking the cushions apart and chewing the remote control. So all of these things can be very stimulating and fun things for dogs. And again, a beagle would be a classic example of that, right? So it could be kind of normal behavior that's undesired by the caregiver because now it's the sofa cushions and it's the remote control. Or it could be a true sort of distress reaction due to separation. So there would be more questions I would need to ask, and these are the kind of cases that we really need to dig into to understand what the underlying motivational state is and what the emotions are that the dog's experiencing. But, you know, environmental management is the first thing. So if you're leaving the dog and there are things that you don't want them to chew, make sure they're put away, right? So remote controls, anything that's expensive, any electronic devices, make sure you put them away out of reach. Sometimes you can get around that by confining the dog to a crate when the caregiver isn't there. However, that means the dog has to be absolutely super happy and comfortable in the crate, right? The crate is their safe place. They love going in there, but that can be protective against destruction in the home. Getting videos to understand like his body language when that's happening. So I'll often tell my caregivers to set up a camera, whether it's on a phone or, you know, you can get like a doggy cam in the room, just to try and understand what's going on there, and then addressing whatever it is that we find. So there's not an easy answer to that question. It could be like a million different things, but that's what I do as a veterinary behavior specialist or a veterinary psychiatrist. I dig into all of these things and we find out what's the root cause, then we change that, and then the behavior resolves.
So in my sister's dog's case, it's very personal to me.
Yeah.
I love that dog. So I have always noticed that he always goes and he grabs people's socks. Like all the socks in the house, he'll grab, and he has one place under. I think he was a rescue dog. We had rescued him under the bus. From under the bus, we had rescued him. He was a puppy that time. So he'll always bring all the socks and he'll go inside under a sofa and he will fiddle with them. So is it something like it shows some sign that he's missing something or something like that?
Again, it's a little bit difficult to find an exact answer just from that description, right? You'd need a much bigger context and ask a lot of questions about how he is in his everyday life.
He's very calm. He's very calm, and we just tell him like he's like an uncle. He'll just say
like an uncle.
He'll just look around. Everything is okay. Everyone is okay. Okay, fine.
And it can have so many causes. It could be completely normal behavior, right? He grabs something that's of value to him and he caches it. We call it caching, which is like hiding it in a place and keeping it all together. You'll see some dogs do that. They bury things, right? And they go back later to cache it. So it could be completely normal behavior. Just happens that socks are his preferred item. It could, however, be a sign of maybe some emotional dysregulation. But again, you'd need to kind of delve a little bit deeper there.
So one more listener actually two more listeners, I'll club here.
Okay.
Okay. So one of the listeners, she told us that usually she has a 4-year-old cat. Very calm cat. Okay. So her name is Snowy. So she hissed and lunged and scratched at a visiting friend. Yeah, a guest. So visiting friend, she lunged and scratched, who had just walked into the living room. In another case, it's a golden retriever, another listener. She has a golden retriever. So he barked, growled, and snapped at a guest entering the house. So in both the scenarios, guests have not tried to touch. They have been as patient with the pet, like they allowed them to sniff around or whatever they want to do. So, but still the pets showed that aggression towards the guest. So, like, is there what could have caused this, and are there signs or something which the owner could have noticed prior to?
So first thing to say is that dogs and cats are quite different from each other. So it's probably going to be difficult to club those two together. However, the idea that pets are sometimes fearful of and may react to visitors to the home, that's kind of a common theme, right? So a lot of the time it's to do with feeling fearful of somebody coming into their safe space and not quite knowing how to manage that social scenario. People coming in from outside, they might be unknown, they're not in their inner circle, they're not familiar to them, they're not bonded or trusted. They might also smell unfamiliar, right? It's possible that if somebody, for cats, for example, if somebody that has cats themselves comes into the home, they could smell of their other cats, and that could cause the cat to become defensive. A lot of it is to do with socialization periods and early learning. So what have these animals learned about unfamiliar people or people in general during their very important socialization period? So in dogs, that's from about 3 to 16 weeks. In cats, much shorter, from about 2 to 9 weeks of age. And social experiences that they have in that time can be really predictive for the future. So if when I was a puppy or a kitten, I learned that humans are great, I might not be that scared of unfamiliar people.
Okay.
But if in that time I learned that humans can sometimes do things that we don't like, then that might cause us to be more cautious to unfamiliar people who aren't our immediate family. And again, there can be so many different causes for this. It's usually fear-based in my experience. So
do they sense, like, are these people pet friendly, or aren't they they aren't pet friendly? Do the animals sense that?
Not necessarily. I think sometimes we can think that, and I think sometimes people that are calmer themselves, that show less threatening body language, let's say for dogs, for example. So if a visitor came to the home and was like staring at the dog and trying to interact with the dog, I know you said they didn't do that, then that might be a higher risk scenario than if somebody like myself entered the house, knew how to respond, didn't give direct eye contact, stayed kind of side on, not frontally facing. The dog might feel a little bit less threatened in that situation. So sometimes I think the way that the visitor reacts or behaves, yes, can have an influence. But on the whole, I think if a dog or a cat is fearful of unfamiliar people in general, there might not be a huge difference between those that love dogs and those that maybe aren't so familiar with dogs.
So if suppose a guest is coming who is very scared of animals,
Yeah.
a dog or a cat, whosoever, they are very scared of animals, then in that kind of a case, what the pet parent should take care?
So that in that scenario, I would say separation is the safest thing to do. So either separate the dog into a different room, put some calming music on, give them a Kong to keep them busy if it's a dog. If it's a cat, you know, put them in a separate room where they have everything, litter boxes, food, water, give them a licky mat or something that's, you know, really high value to them. So the separation, especially for somebody coming into the home that's scared, because you don't want your visitor to feel fearful, and you also don't want to put your pet in that situation, right? So separation is the first thing. Now, in some cases, some pets find it difficult to tolerate that separation, right? You separate them and then they bark or they become very distressed. I have some clients of mine in really extreme cases who might send their dog to daycare if they like being at daycare for the day when they have visitors coming over. So we just don't even create that situation. So avoidance, non-exposure to those triggers, that's the safest way of going around it. Otherwise, you could be in a situation where an aggressive event happens, and that would be awful for the visitor, for the person who, you know, whose dog it is or cat it is, and for the animal as well. So safety management is always really important there.
Okay. So as you had earlier mentioned, separation anxiety now is being termed as separation behavior. Yeah. So can you elaborate on it?
Yeah, I think we've always been very quick to jump to the conclusion that all separation-related behaviors stem from anxiety, and that's not actually the truth. Even within that realm of fear and anxiety, you can have separation fear, separation anxiety, separation phobia, panic-related behaviors. So even within that group, we have to make some distinctions because it's going to affect how we treat that patient. But even bigger than that, the animal can show unwanted behaviors when they're separated from their caregivers for other reasons. It could be boredom. It could be that they have, you know, they're not able to access a toileting area. It could be that they don't have access to resources. There's not enough food or water, especially if the owner's gone for a long time. It could be other things such as hearing a noise outside and starting to bark, because all of a sudden the comforting presence of the owner isn't there anymore. So now they're isolated on their own, something happens in the environment and they find it harder to deal with that. So that's not separation from the owner per se, that is a fear behavior from the environment when separated from the owner. So these are all very small nuances, right? They're very small pieces to pick up, but they're so important because they affect our treatment plan. And if you don't get a really accurate diagnosis on what's happening, you could start a treatment plan that might not work because you haven't actually targeted the key problem.
So how can the pet parents know the key problems? What signs they have to look for?
So I think it's really difficult for pet parents to do that on their own.
Yeah.
So oftentimes they would need to bring in a professional like myself to do that. But the first place to start is to get videos. Videos have literally changed the game. So being able to see what that pet actually does when they're left alone is so important. It could be that they're just bored, right? And they're counter surfing or getting into mischief because they're bored, but there are no signs of distress or panic. Or you could see on the video, dog is perfectly calm. All of a sudden, a loud noise happens. So this has happened to some of my patients where, let's say, the fire alarm went off in the building, or I don't know, the AC somehow, you know, something happened. And all of a sudden you can hear the noise on the video, and then the dog becomes startled, and then they start barking or pacing or getting worried. But you know, they're not doing that because they've been separated from their owner. They're doing that because something happened and they didn't have anybody there to reassure them.
So these loud noises also make them very anxious, like even fireworks. Even fireworks are there, or as you said, the alarms, the fire alarms.
Not all dogs, but many dogs do suffer from noise-related fears and phobias, and we see that, right? Fireworks, like you said, is the classic one. And again, it's on a spectrum. Some dogs are nervous, but they can somehow still cope, and some dogs just simply can't cope with those noises.
Even do we see this kind of behavior in cats also?
Yeah, but cats tend to hide. So often the owners don't maybe recognize it that much. So a cat, if they hear a noise that they're scared of, they'll just find like the best place to hide. That can be like literally under the duvet in the bed, or, you know, you can get the beds that have the drawers underneath where the cats can go to hide. So they're still fearful. They're kind of finding a way to cope with it by hiding. But the owners think, oh, well, you know, they're just hiding, therefore surely they're not that fearful. But they can absolutely be very fearful of noises as well.
So anything like you can give some tips where the pet parents can do something at their home when this kind of the alarm is ringing or something, where they can calm their pets or something, especially when they are at home.
Yeah, so I think the very first thing to say is never punish them. So never shout at them or punish them for being scared, because that's not going to be helpful. Finding ways in which we can block out those noises. So let's say it's fireworks, right? We can draw the blinds, we can play some music, we can engage with the dog and try and distract them, maybe give them a food puzzle toy. It's perfectly okay to give them a hug and comfort them, right? We're not reinforcing anything because it's an emotional state that we're dealing with. It's not an operant behavior or acute behavior. There's a difference there. Many dogs actually are really good at finding places to hide themselves, and they'll usually choose a room in the house that doesn't have any windows. So oftentimes it'll be a bathroom, right, where it's like 4 solid walls, no windows. Sometimes they'll go into a closet. So I've got one patient at the moment, when he hears a noise that he doesn't like, he'll take himself down like into the basement, and he has like a little hiding cave there. So providing those kind of coping strategy areas is really good. But if the dog is really distressed in that moment, even though he's found a place to hide, we might still want to back that up with either medications to help reduce that anxiety, or maybe supplements or pheromones. Now, supplements and pheromones can only achieve so much, right? If you have a patient that's very, very fearful, a pheromone or a supplement probably won't be enough to help them. But we have a couple of medications that are actually licensed for use in dogs for noise phobia, so there are absolutely things we can do.
So before we move on to the next, I have one personal question. Are the dogs dogs and cats, are they color blinded? I'm always confused with that, because some of them say they are not.
So all of our animals are what we call dichromatic.
Okay.
So they only see 2 color spectra, right? We as humans, we're trichromatic.
Yeah.
And then we have other species like birds they can see, you know, ultraviolet and all kinds of crazy light. So they have a different perception of the world again. But if we think that our pets are dichromatic, they can see some colors, but they won't have the full spectrum of colors as we see them as humans. So most of them fall somewhere in the region of, they'll see like a bluey greeny, and then they might see like a yellowy orangey. So those would be the 2 types of colors that they can see. So their visual perception of the world is going to be different to ours. Yeah.
Okay. Let's move on to the next section. Okay, I will read out some of the myths which we come across. So maybe you can just put a light on them.
Okay.
All right. Okay. So pets act out of spite.
No. So spite is not an emotion that we think pets can perceive. It's a very human construct, right? Spite.
Right.
So when we think about emotions in pets, we follow the Yak-Panksepp structure that has kind of 4 positive emotional states and 4 negative emotional states that we think our pets can experience, and we kind of stick to those. But anything that's like jealousy or spite that has complex construct and human thought process behind it don't really happen in pets.
Okay. A tired dog is always a good dog.
Also not necessarily, no. I actually think tired dogs, especially if they're tired from excessive physical exercise, they can become quite sore, right? Imagine if you go on a super long hike, you're going to feel it in your muscles the next day.
Right.
And our dogs can feel the same. So sometimes by trying to tire them out, we can inadvertently cause a number of things. Either we can make them sore from too much exercise, We can cause their emotional state to be heightened because they're like overstimulated, just like children. Or we just make them super fit. And then they need even more exercise than before, which can be a negative thing. So yeah, tired isn't always what we want to achieve. Calm, yes, but calm is different to tired.
Okay. Medication for behavior means my pet is broken.
No. That would be an awful thing to say, because that would mean what, all humans that take medications for behavior are broken? So no. It means that they've had a challenge in their past that they need extra support with, and that's what we're here to help them with. So no, they're not broken.
They're never, but even humans are not broken.
Exactly.
Yeah. If a dog wags its tail, it's always happy.
No, that's also not true. So a tail wag is so interesting, right? So I would say if we have a long, soft, high amplitude tail wag where the whole of the dog's body wags, that's usually a positive, happy wag. If we have a very tense tail that might be up and a very tense, tight wag, that might be a dog that's actually very hyper aroused, overstimulated, maybe frustrated, and maybe trying to deal with a situation that they're struggling with. So no, that's not true, yeah.
Once aggressive, always aggressive.
That's also not true. Now, I will say that a dog that has practiced an aggressive behavior in the past may be more likely to choose that behavior again in the future if they found that behavior to be successful, right? So for example, if a dog growls at me and I step back, the dog's like, great, that's exactly what I wanted. She wasn't listening to my earlier cues, but the growl was the thing that actually caused the successful response, which was to give the dog more distance. So he's going to be like, right, in the future, whenever she comes too close, I'm going to growl and she's going to step back. So there is a learning to that, and there is, the same as with us, if we learn that something we do is successful, we do it again, right? Potentially. And it's the same for dogs. However, let's say we've got a dog that's got a really sore ear and we pet them on their head, close to their ear, and they defensively maybe snap. If we take care then of that painful ear and take the pain away and make that dog less painful, then they're likely not going to respond in that way again, because that was a self-protective, almost reflexive, although it wasn't a reflex, but it was a behavior in that moment to protect themselves.
Separation anxiety means your pet is spoiled.
That's completely wrong. I think for all the reasons that we've spoken about already, right? Yeah, so no.
Okay. I will come to our next section, which is rapid fire behavior decoding.
Okay. Here we go.
Okay. So I'm going to this time read out the different kind of behaviors and let you decode them.
Okay.
Yeah. So dog growls softly while being petted.
Now that could be a number of different things. Some dogs also growl in play, right? I mean, I think while being petted is less likely to be in play. It's usually when they're playing with other dogs or on tug of war. That could be a perhaps non-distance increasing growl. But if they're being growled, softly growling while being petted, it probably means, please stop petting me.
The cat slowly blinks at its owner.
That's an affiliative, right? That's a friendly, I love you behavior.
Dog yawns repeatedly during a vet visit.
Anxiety.
Okay, anxiety. Cat hides under the bed when guests arrived, which we had.
We had it exactly. Yeah, so fear of the guest.
Okay. Dog jumps up on strangers.
I like this one. Probably information gathering and maybe conflict and unsure how to deal with that social situation. So dogs get a lot of their information from smell, and the best places to get smell from people are around their faces. So jumping up to try and get information is probably a sign for some social anxiety or social tension.
That's why they tend to come towards your face, trying to lick you, trying
Exactly, to get that
okay.
information. And I think we learned during COVID, right, that like getting information can be really important if we're feeling unsure about a situation. If we don't really know what's going on in the world, we want information, and that's how our dogs feel as well. So that is being like, hello, who are you? Are you safe? Can I trust you? What kind of information can I get from you? Do I need to be worried? So that's all information gathering. The problem with that is that if the dog isn't able to compute that information, they might escalate those behaviors. So we always need to be quite worried when we have a dog that shows this overly friendly. Some people could interpret that as being, oh, he loves everyone, he wants to jump up and greet them. But actually, no, that's social tension, and that is a behavior that I would always be like, oh, okay, we need to just be not worried, we need to be mindful here of what the dog's trying to communicate to us and how we proceed with that information.
Cat's tail tip twitches while sitting still.
So that could be completely normal. If the cat has like the tail upright and the little bendy tip at the top, that's probably friendly and not playful, but friendly. If the tail is like flicking, that's a sign for frustration.
Okay, okay.
Like it was with the petting, right?
Yes, yes. And how do the cats gather? Like dogs gather the information while they smell and they lick us. And how do the cats do that?
Also through smell. It's actually really interesting. I think we tend to think about dogs as being really great with smell, but cats are incredible at smelling pheromones, at pheromone communication. Pheromone is an intra-species communication, so it's only cat to cat, but cats also gain information from us via smell, also visually, the way that we interact with them, whether they feel we're safe through our communication with them. So all of those things, I would say.
Okay, okay. So, can you like give us 3 quick tips, okay, for calming any anxious pet? Quick ones, only 3.
Okay, the first thing would be don't punish them, don't shout at them, reassure them. If they're anxious, help them. They're not acting because they're being naughty or spiteful, they're acting because they're truly fearful. So don't punish them, don't shout at them, but actually calm them. The second thing is remove them from the situation that they're finding difficult to deal with. So if the dog is really anxious on a walk and is signaling that they want to go home, take them home. Don't force them into situations that they can't deal with, because we're probably going to be making the situation worse. I think a lot of people try and habituate, expose, so that it gets better. But if there's true anxiety present, it's going to actually make things worse. And then the third thing I would say, there could be so many things. To be honest with you, the third thing I would say is learn to read your pet's body language, facial expressions, and communication, and not just only learn to read them, but respect them and listen to them when they're communicating.
Okay. One small daily habit that could make a big difference in pets' mental health?
Make sure they get enough sleep.
Okay.
So for dogs, 12 to 16 hours per day. For cats, similar. So, and obviously it can be difficult to force them to sleep, but that means creating an environment where they can safely sleep. But sleep, I would say, is an underrated behavioral tool.
Okay, okay. And have you ever had a case where a pet completely surprised you with his behavior?
I mean, so many, both positively and negatively. I mean, I've had so many cases where
we can go for a positive.
A positive one. Yeah, I've seen so many cases where I thought, gosh, I'm not sure whether this is going to have a good outcome. And actually, the owners were so fantastic at implementing everything I recommended. And we got the right medication for the right situation. The dog responded, or the cat responded well to it, and it had a super positive outcome. So those cases are actually quite frequent. Sometimes you think, gosh, this doesn't look good, and then actually things turn around quite quickly. So I think that's also a bit of a message of hope, and if you are struggling with your pet's behavior, there are absolutely things we can do to help.
So let's say if your pets, they could talk for a day, what are they going to tell you?
Oh my God, I actually don't want to know. They probably think like, why are you doing this? Why are you doing that? I mean, I hope that my pets would say that they feel comfortable in their environment and they feel secure in their social interactions with us, myself and my husband. That would be my biggest hope, yeah.
Okay, so we are coming at the end of the podcast now. Okay, so I want you to look at the camera and give some good, like a message to the pet parents, the new pet parents, the existing ones, what they can. And also, I would like you to share where they can reach you.
Sure. So pet parents, new pet parents, or, seasoned pet parents, I think the best thing that you can do for your pet is to learn how they communicate, to learn how to read their body language and be aware of their emotional state. Understand that pets do have emotions and that it's really important that we know how to read them, so that we can protect them, that we can remove them from situations that they find challenging. So that would be my number one top tip for everybody. You can reach me either here at the German Veterinary Clinic in Abu Dhabi. I also have an online business called Trinity Vet Behaviour, or Trinity Veterinary Behaviour is the website.com. You can find loads of really great resources. I actually have 2 amazing online courses. One is called Learn to Speak Dog. The other one is called Learn to Speak Cat. So if you are interested in learning more about your pet's communication, that would be the best place to start.
And do you give online consultations also?
I do. Yeah, I do online consultations. So if you're not in Abu Dhabi, I have a lot of clients in Dubai and actually all over the world, all around the world. Online consultations are available too, yeah.
Yes, that was so great chatting with you today, Dr.
You
Katrin.
too.
No, even I had a lot of doubts in my head and I could clear them also.
Good. I'm pleased to hear it.
So thank you so much for being a part of Furhour Talks. Hopefully we come back again to you with the next episode.
That sounds great. I would love that. Thank you so much.
Okay, thank you.
Thank you.
Thank you.